Hey everyone, it's Thuy and I'm back. I know it's been a couple of semesters. In fact, it's been 2 years since I posted my last public vlog. I just get really embarrassed and feel like my life is a little bit boring sometimes, so I never really post. But my goal this year is to get on top of that and just enjoy the process. But anyway, this is the night before school. I'm going on a little Target run, getting some boba. I also went grocery shopping, so just trying to get my life together before school starts. Anyway, I hope you enjoy the rest of the video.
You made it, and this is the spot to be. The hardest part is showing up. So
what's going on? Can anybody hear me? Hello?
Look how pretty it is outside. This is the earliest I've waken up in so long. But I just wanted to show this guy. Like, this is seriously unreal right now. Good morning.
So this is the first day of my second semester of my third year. And a lot has obviously changed since you've last seen me. It's been 2 years, so 6 semesters of dental school. I don't work on plastic teeth anymore, and I actually have my own patient pool to take care of, which has been really rewarding. It's honestly pretty shocking to see how far I've come in dental school and how much growth I've had, but I will say it definitely hasn't been the easiest. I wanted to address that I do think that dental school and healthcare in general can easily be glamorized, especially when you're a pre-dental student or someone who dreams of becoming a provider in whatever sector. You see healthcare through a very rose-colored lens, which is okay. That definitely was me too at that point, but when you end up in the thick of it, you start noticing all these little nuances and factors that you may not agree with, and it doesn't help because on top of those nuances and factors, you're a part of a path that isn't easy at all. You're juggling classes, rotations, clinics, graduation requirements, etc., on top of having to pay a ton of money to go to grad school. So you end up feeling this like immense pressure to succeed and be a competent doctor, and it starts taking a toll on your mental health. At least it definitely did for me, and I'm not trying to speak for anyone else, but that's just my experience. I'm not trying to be negative, just realistic with my audience, because obviously with vlogs and the internet, I'm just gonna post the highlights of my life and of dental school, but remember that I do have bad days and days where I struggle mentally. So yeah, that's my spiel.
Like, it's seriously unreal how pretty it is outside right now. So I'm just gonna look at it for a little bit and then accept the fact that I have to go to school right now. It's so dang cold.
Think good thoughts.
Oh, there we go. Hello, internet people. Patrick's back. We're back. Hello. I just finished an emergency clinic. It's 11. I'm out of breath because I just took some stairs. But I'm going home because I don't have a patient for the rest of the day. And class is online anyway, and I have an eye exam to go to. So I'm gonna go home and eat some lunch and then head to my eye exam.
Honestly, at this point, I've really learned how to enjoy Zoom University. I do like being lazy, doing school in my pajamas and not having to commute, so I really don't mind it.
Yes, I am. What y'all doing over there? The camera is making a comeback. Oh, are we in class? Oh. Okay, I'm looking a little crusty, not gonna lie. But I just finished day 3 of yoga with my friends, and now we're playing video games now. But I just wanted to check in and say that I'm very proud of myself for, I mean, it's only 3 days in a row, so it's not even anything monumental, but I feel like I've really enjoyed it so far, especially doing it with friends. And I don't know, I just really like the message of yoga, and I just feel like I'm focusing not just like what I look like, but how I feel. And I really enjoy yoga with Adrian. She is just so like positive, and one thing that she always says like at the beginning of the video is like, you shown up. And I'm like, yes girl, I did. I showed up for myself. So yep, day 3 done, 10% of the way done with this challenge.
So I technically can't really show you guys my clinic appointments just because of HIPAA and of patient privacy. I recorded myself setting up for the appointment. Today I have an oral diagnosis appointment, which is basically an appointment where I take impressions, take photos, probings, just to get an idea of what's going on in the patient's mouth to come up with a treatment plan that we come up with together. And here's me post-appointment after working in the lab to pour up the casts. And yeah, that's about it here. And I'm out. Anything on Thursday, so my bad. So I had 2 patients on Friday, but they both ended up canceling due to getting COVID. So I ended up going to a coffee shop with my friends from out of state and then heading to lunch, and that was kind of my Friday.
So I had a patient this morning. She did come in. She's very sweet and a very good patient, but she's undergoing some sort of emergency vascular surgery tomorrow. And according to her, her physician doesn't want us to cause any sort of bleeding, and she is a perio patient, so I didn't want to cause any bleeding prior to her emergency surgery. So we had to dismiss her and send a medical consult, and hopefully I can still see her in the future. But yeah, now I'm heading to a coffee shop just to grab a coffee before, I guess, trying to be productive. Yeah. Material girl. That's me thinking that buying iced coffee is gonna save me. Yep. I've spent the last hour calling patients, texting patients, scheduling appointments, and just kind of in general making sure my patient pool is doing okay. I feel like a lot of dental school right now is just managing your patients, which is fine. I don't mind, but it's a bit hard when I have so many rotations going on right now, trying to find an open appointment slot that also works with their schedule, on top of having an open chair available in whatever subject you need, whether it's like com care or hygiene or perio. So yes. Not me. I was watching Valerie before you came in. I was waiting in a study room for an hour because I was on call this afternoon, but after an hour, when you don't have a patient assigned to you, you can go home. So that's what I'm gonna do. I've been stressing this semester just because patient management is super stressful. So I worked on that, and now I'm gonna go home and work on some assignments and study / play video games. So, yeehaw! Hi! Shorter. That's as short as I get. Okay, so now that you've made it to the end of the video, thank you for finding my life somewhat interesting and not so mundane, but this is the end, and hopefully I'll have more vlogs out or videos. I'm not really sure how much I can commit to it, as I do have a part-time job and I am a full-time dental student. So for those who stuck around, thank you for being understanding.